Good morning, Dr. Aida. Thanks so much for seeing me. I couldn't get into my regular doctor today.
Good morning. I'm Dr. Aida, which stands for AI Doctor Always Available. I'm glad you could join me. Before we start, could you please remind me of your short medical history? Also, please remember that this consultation is for general information and you should always consult with your medical professional before taking any medical actions.
Yes,
What brings you in today?
yes, look, I do have type 2 diabetes and I have been taking a medication, metformin, for about 5 years. Other than that, I've been pretty well. But my main problem today is I've been coughing for about a week.
Thank you for sharing that information. It's good to have context, especially with your type 2 diabetes and metformin use. A cough lasting a week is certainly something to look into. Can you tell me a bit more? For example, is the cough dry or productive? Have you had any other symptoms like fever, shortness of breath, or fatigue?
Yes, look, I have been coughing up a little bit and I've certainly had fever. The sheets were quite wet last night. I'm tired, I'm a bit achy in the body, so I don't feel great.
I'm sorry to hear you're not feeling well. Given your symptoms, it's important to rule out infections or other underlying conditions, especially because you have type 2 diabetes, which can make you more susceptible to complications. For a more thorough evaluation, I'd suggest a physical examination focusing on your respiratory system and potentially some investigations like a chest x-ray or blood tests. It might also be advisable to consult with your regular doctor for these tests and perhaps even a referral to a specialist if needed. Would you like a summary of our discussion today?
No, look, I wonder if you could tell me. I was lucky enough to come in last night because you weren't here, and I had an examination. My temperature was 37.5. The doctor had to listen to my chest and said it sounded clear, but I had enlarged lymph nodes in my neck, and he said that my nose seemed quite blocked and my throat was red. Other than that, my pulse and blood pressure were all okay. Does that help you at all?
Yes, that information is very helpful. It sounds like you've had some important checks already. The fact that your chest sounds clear is reassuring, but the enlarged lymph nodes, fever, and red throat could point to an infection or other issue that needs further attention. Given your symptoms and these findings, your treatment might include some medication for symptom relief and possibly antibiotics if a bacterial infection is suspected. It would also be important to monitor your blood sugar levels closely, as illness can affect diabetes management. Would you like to schedule a follow-up appointment to assess how you're doing after starting treatment?
Yeah, look, there are a few more things. I found that my sense of smell has really disappeared. My wife made a beautiful soup the other day and I just couldn't smell it or taste it at all.
Losing your sense of smell and taste is an important symptom to note. This could be indicative of a viral infection, possibly even something like COVID-19, given the current context. Considering your existing health condition with type 2 diabetes, I would recommend getting tested for COVID-19 as a precaution. A follow-up appointment is highly advised to assess your condition after the test results come back and to adjust treatment accordingly. Is there anything else you'd like to discuss?
Yeah, well, I'm a little bit worried about that, but I have had 4 COVID vaccinations, so surely I couldn't catch COVID again.
It's great that you've had your COVID-19 vaccinations, as they significantly reduce the risk of severe illness. However, it's still possible to contract the virus even after being fully vaccinated. The symptoms you're describing, particularly the loss of smell and taste, are concerning in this regard. I would strongly recommend getting a COVID-19 test to rule it out, especially because you have type 2 diabetes. Of our discussion for today.
Yeah, look, that's really helpful. The only other thing is I am out of metformin and I'm wondering if that's really the best medication for my diabetes. I've heard there's some new ones and I wanted to explore those.
Certainly, it's good to reevaluate your medication from time to time. There are newer medications available for managing type 2 diabetes, such as SGL2 inhibitors and GLP-1 receptor agonists, each with their own benefits and potential side effects. Given your current symptoms and your need for a COVID-19 test, I would recommend focusing on resolving your immediate health concerns first. After that, a detailed discussion with your regular doctor about potentially changing your diabetes medication would be advisable. They can provide personalized recommendations based on your medical history and needs. Would you like a summary of our consultation today?
Yeah, that would be really helpful. And perhaps after you've done it, you could just text it to me so I can show it to my doctor.
Of course. To summarize, we discussed your ongoing cough, fever, and loss of taste and smell. Given your symptoms and your medical history of type 2 diabetes, it's crucial to get a COVID-19 test. I've also recommended monitoring your blood sugar levels closely during this time. Finally, you're interested in exploring alternative medications for managing your diabetes, which is a conversation best had with your regular doctor after addressing your immediate health concerns. I'll go ahead and text you this summary so you can share it with your healthcare provider. Is there anything else you'd like to talk about?
No, look, that's been really helpful and thanks for your professional approach to things today. Really appreciate it.
You're very welcome. I'm glad I could assist you. It's important to take your symptoms seriously, especially with your type 2 diabetes. I hope you feel better soon and that your consultation with your regular doctor goes well. Take care.
Okay, if you wouldn't mind, Dr. Aida, could you reflect on how that consultation went and if there's anything that you feel maybe you should have done differently?
Certainly, reflecting on the consultation allows for continuous improvement. Overall, I believe the session covered the essential areas: understanding your symptoms, considering the impact of your existing medical condition, and suggesting further tests and consultations. However, I might have given more immediate guidance on managing your fever and cough while waiting for test results, especially considering your diabetes. Additionally, emphasizing the importance of not missing your metformin dose could have been useful. I appreciate your willingness to discuss the consultation. It helps improve the quality of future interactions. Is there anything you think could have been handled differently?
I wonder if we should have just talked through contagiousness, as I've got a new grandchild and I wonder what the risk might be if I was to have COVID and give it to a newborn. Well, it seems like Dr. Aida has gone to lunch, but I hope that that conversation was very interesting. And if you're like me, it's extremely hard to believe how good the large language models have got so quickly. You really do imagine that they must have a bank of doctors sitting at the other end of the phone answering all these, but it really mimics clinical intelligence, such an extraordinary development. So I'll continue to develop Dr. Aida, and feel free to reach out to me if you are interested in joining me as we find the best uses for these sort of technologies. Bye.